everybody, it's Dr. Jo and supercalifragilisticexpialidocious. Today I'm going to show you how to use a massage gun for knee pain. So let's get started. So when you have knee pain, using a massage gun on the muscles all around the knee can really help relax those muscles. What is great about using the massage gun on these muscles is sometimes they get so tight, they pull that joint together, and that's what causes the pain. So if you can loosen up the muscles, it's great. Sometimes maybe if you have a strain, like in your hamstring or a quad strain, or even down into your calf where maybe it's just cramping up and putting pressure on there, a massage gun is great to really loosen up those muscles. It's not designed to be used on bony areas, so make sure you're working the muscles to loosen them up. And always check in with your doctor or your healthcare provider to make sure that it's okay to use the massage gun, because there's some precautions and contraindications where you shouldn't use it. So make sure that it's okay for you to use. So starting off, if you have knee pain, it can be patellofemoral pain syndrome, it can be your quad tendon, it can be IT band issues, or again, you can have, a cramp in your calf, or you can get lots of just tightness in there from running and stuff. And so again, using the massage gun is a great way to loosen up your groin muscles. All of these muscles either come and cross that joint, or they come like the quad muscle goes into the quad tendon that attaches to the kneecap or the patella. So getting those loosened up should really help reduce some of that knee pain. Now with the different massage gun heads, you can often use really which one is more comfortable for you, but a lot of them have, ideally this works best for. And so the ball head is great for large muscle groups like your quads, your glutes, things like that. And so really what you want to do is just work it lightly. You don't have to push down hard. Let the massage gun do the work. It's designed to do all the work. So you don't have to feel like you're working hard to do it. Just get that motion going. So for instance, if I'm going to want to loosen up the quads, I'm just going to run along the quad muscle on top here where that quad tendon goes in. So I might even start back here and just slide up and then nice and slow come back down. So it should be a nice slow movement. It doesn't have to be, fast back and forth like that, but really working the muscle to loosen up. Now, if you have some swelling in there, some irritation that you want to work back into your system, out and into the body, you can just go the furthest away, closest up to help move that fluid out of there. That might help a little bit more, but it's going to work this way as well. Now, you always want to just spend maybe 1 to 2 minutes on each area, and you don't really want to go more than 10 minutes at a time when you're working on stuff. So if you've worked on the quad for 2 minutes, then you can go over to the IT band. So it's the same concept. This IT band comes and actually crosses that knee joint. So if you want to start up here in your TFL or your tensor fasciae latae that turns into the IT band, you can start up here at the hip, nice and slow, cross that joint. You might hit the bone a little bit and it bumps, so don't stay there for too long and then come back. Or you can stop before you get there and work this area and then work down there a little bit later. So again, you can go nice and slow up and down for that 1 to 2 minutes, or if you feel like there's some swelling and you want to work it back up into the system, you can do that way as well. Now, what's great is if the ball head doesn't work great for you and you want to try something else, maybe you're super sensitive, maybe your burst has flared up a little bit in there. This is an air cushion head, and so it's nice because it's a little bit better for sensitive areas. So, if I've got that bursa is kind of trying to get that bursitis and it's flared up a little bit and it's causing pain all the way down into the IT band down here, you can work on this area maybe a little bit more specific, but with the air cushion, this one is not quite as much pressure. So I'm still getting that good vibration that's going to increase the circulation, that's going to relax the muscles around it, but it's not quite as intense as the other one. And you can still do the same thing where you're going up and down. Again, see now when I went over that bony area, see how it didn't bump quite as much because it has that air cushion component too. So that makes it a little bit easier to quickly go over those areas. Then if you're working those muscles all the way around, well, let's say I've got like maybe a little trigger point in that calf area there, and this, I can feel it. I'm pushing it right there, and I'm like, that's the spot. Then you can grab the bullet head, which has a little bit pointier area to help get trigger points or deeper tissue. And so this one you just want to kind of stay in that spot where that knot is, or that trigger point. So if I'm pushing and I find it right there, I'm just going to hold it there. So with this one, you could put a little bit more pressure on it. I'm pushing a little bit harder than I would with the other ones because I really want to get it into that spot. So with a trigger point, maybe 30 seconds to a minute, since you're kind of staying in one spot, really to loosen it up. But then you could also go up and down with the bullet head as well. You don't have to stay in one spot, but because that calf is two muscle bellies, sometimes going down in the middle between the two with that more specific area in there is very comfortable and relaxing in there. So there's a lot of options for the massage heads, but really, it can be whichever one is most comfortable for you. They all have good specific things to use, but they also can just be used for, hey, I like this flathead one because I feel like it's more comfortable maybe on the inner thigh area because this is just a little bit flatter area over here. So then I can get the groin area and those inner thigh muscles, those adductor muscles. So it's a lot of nice different options to use, but when you have that knee pain in there, using the massage gun to get all the muscles around it, you can even get that anterior tibialis muscle on the shin there too, because that could cause some knee pain, will really help loosen everything up. So there you have it. That's how to use a massage gun for knee pain. Don't forget to subscribe. Where, Callie? Yeah, down there. And remember, be safe, have fun, and I hope you feel better soon.